I'm Dr. Pazderka. I'm a program director here at WMed Emergency Medicine. So there are two big things that I think that makes us unique. Number one is the ICU. So you do a lot of ICU, far more than the usual residency, because if you can take care of the sickest patients, you can pretty much take care of anyone. And how we do that that's a little bit different is our MICU. Our MICU is made up of all ER teams. So there's no internal medicine residents, there's no fellows. And what that does is you develop that camaraderie and that team atmosphere with your other ER residents. So the second thing that makes us unique is our EMS. Our EMS is probably the best in the United States. And the reason I say that is at a resident level, so not at a fellow level, but at a resident level, you have a residence response vehicle. So 24/7, 365, we have an emergency medicine resident on that vehicle, and they're responding to all those critical calls, all the echo calls, all the cardiac arrests, all the major motor vehicle accidents. And so you get that education and you get that autonomy on working on that vehicle, and I think it broadens your education. So the Emergency Medicine Program at WMed is really a great educational experience. It's like working out in a gym. The more reps you do, the bigger you get. It's the same thing with the educational process. The more patients and different patients that you see, the better educational experience you're going to have. We are a 3-year program that has 15 residents in each class. When you have 15 residents in a class, it optimizes your time a little bit. So let's say you need to change a shift. So having 15 residents in a class allows you to make trades a little bit easier because there are more people off to make trades with. You also, when you're off, other people in your class are off, so you have the ability to go out and hang out with people in your class or the upper classes, and you develop those tight-knit friendships that you want in residency. And I think that makes Kalamazoo a very fun and interesting place to live.
I'm Sarah Skini. I'm one of the interns here at this program.
Hi, my name is Mohammed. I'm one of the first-year resident physicians, currently rising, second year.
We are right now outside Bronson Methodist Hospital, which is one of the hospitals that we rotate at for our ER shifts and our ICU shifts as well.
Right, it is a level 1 American College of Surgeons verified trauma center that sees both adult and pediatric traumas. It sees around 100,000 visits in the emergency department per year, so there's ample opportunity to see a lot of pathology here.
In addition to which, it's also a burn center, so that's also pretty cool. During our trauma rotations, we do see a good number of burns cases as well.
Right. And the emergency department runs on a pod system, so essentially we have multiple pods that are staffed by multiple teams and multiple attendings. And the workflow is basically you staff with an attending one-on-one for your entire shift, and that is a unique experience where you don't have that senior level residents to staff with, so you staff directly with the attending, and the education and learning is not diluted.
Shifts here are all 8-hour shifts, but they're pretty fast-paced just because of the sheer volume of patients that come in, and we do see an extremely, like you said, a wide variety of pathology here.
Right, and the most interesting part about Bronson Methodist Hospital is that we get transfers from a huge catchment area within Southwest Michigan. So you'll see people from down south in Coldwater, Elkhart, even northern Indiana sometimes come up here to Bronson Methodist Hospital to get treatment. So you'll see a lot of pathology, both rural and suburban or urban pathology.
It's not uncommon to do quite a lot of procedures while you're on shift, whether it's intubation, central lines, art lines, lac repairs. There's a lot of procedures to do.
Absolutely, and that kind of segues into trauma procedures, which most resident physicians are interested in asking about. During trauma call-downs or trauma activations, the emergency department team is in charge of the airway and the head and neck portion of the secondary survey. But when you are a resident physician that rotates on the trauma ICU rotation or the trauma rotation, you are in charge of performing both the primary and secondary survey independently and under the supervision of a trauma surgeon, and you get the opportunity to perform procedures like chest tube or thoracostomy insertions, as well as arterial lines, central venous catheters, right in the trauma bay. You get first dibs at these procedures.
think the program here is extremely dynamic. We have faculty that are always bursting with ideas and eager to hear the residents out. And as you move along, they take more and more of your suggestions, your thoughts, your management styles into consideration and sort of help shape you quite a lot. We also demographically, the kind of patients that we see are surprisingly more diverse than you'd expect. And so that's also been interesting from a systems point of view to kind of watch healthcare progress here.
And Bronson uses Epic as an EMR, which is one of the most used EMRs in the country. So that allows you exposure to a certain EMR that's used in multiple other places, and you're able to have that firsthand experience.
So at Bronson, we do our trauma rotations, our L&D rotations, and all our pediatric rotations, and anesthesia as well. And it just goes to kind of show just how well equipped this hospital is. I would say one of the biggest challenges that I myself found in the ED is just kind of keeping up with the sheer volume of patients that we see. But that's always super satisfying at the end of the day when you've seen a huge number of patients but somehow slotted them all off neatly into what needs to be done.
The way I look at it is more patients equals more opportunities to learn, essentially.
Yeah.
Interesting to touch on, the reason why we do our pediatric rotations at Bronson Methodist Hospital is that it is the region's children's hospital, actually. So Bronson Children's Hospital sees a lot of the pediatric population within Kalamazoo and around and surrounding counties. Right now we have in the backdrop Ascension Borgess Medical Center. It is one of the two rotation sites we rotate at, the other being Bronson Methodist. It is a level 2 American College of Surgeons verified trauma center, and it sees around 50,000 emergency department visits a year.
We do our ICU, some ICU rotations here, and our ED rotations here.
Borgess is a comprehensive stroke center and a heart center for excellence, and that means we get to see a lot of neurological and cardiac focused complaints here by virtue of this being a transfer center, essentially, that other outlying hospitals transfer to. It also sees a huge catchment area within Southwest Michigan. We have people that are transferred from down south all the way up to northern Indiana, essentially.
And it's very cool being in the ED, seeing that happen, this kind of seamless transition of, a stroke patient or a STEMI patient come in and sort of, how the wheels are set in motion and very smoothly care is served.
Ascension Borgess also has a mental health unit that also by virtue means that a lot of people are transferred here for mental health emergencies and subsequent hospitalization. We also have a locked psychiatric unit within the emergency department that is equipped to handle people suffering from mental health emergencies.
Yeah, we do palliative care and IR here, both of which are a slightly different pace than ED or ICU. But that's also really important too, because we learn from a lot of very gifted clinicians, how to have difficult conversations, and in IR, how to do very smoothly and efficiently a number of procedures, ultrasound guided.
We use Cerner as one of the EMRs that are used here. It is, I think, one of the most widely used EMRs in conjunction with Epic.
Yeah.
And we get experience using that EMR for patient care, which equips you with essentially the skill set to use that EMR in clinical care wherever you may go, if it's a site that uses that EMR.
And the ICUs here are slightly larger than the ones that we cover at Bronson. And so if you're on overnight, you care for sometimes close to like
12, 15
yeah,
patients, even more.
Quite a large number of patients. And it's a bit trial by fire sometimes if you're on overnight. But I think it's a great learning experience.
In a sense, practicing at both Bronson Methodist Hospital and Borgess Medical Center, you get exposure to the entire gamut of emergency medicine, and that effectually makes you a well-rounded emergency physician.
Yeah, I would say you're certainly never bored between these two places.
Absolutely, absolutely. Adaptability is a skill you learn pretty quick here.
I'm Steve Godfrey. I am the current EMS fellow here in Kalamazoo, Michigan, and so I've been working with the EMS system and the residents here for the last 4 years now. We have a pretty EMS-heavy residency program. MSU-1 and MSU-2 are EMS physician response vehicles. Those are manned by the second and third year residents every day of the year. MSU-1 is a unique experience. We are one of only 2 systems in the country that have an EMS physician on 24/7, 365. It's an experience that most residents in the United States don't get. Second year residents will start to staff MSU-1. They will typically do a 24-hour shift once per block, so every 4 weeks. During those shifts, they will go around and they are automatically dispatched by a county dispatch to any echo priority level calls. Typically that is going to be a cardiac arrest is the most likely one and the one that happens the most often. We average about 1 cardiac arrest per day here in the county. Residents in MSU-1 and MSU-2 are also able to jump calls. They're able to go on pretty much any call that sounds interesting, and we encourage that actually because it gets our face out in the community. It lets the medics know who you are. It lets us and the residents get to know the medics. And that creates just a greater cohesion. We're not showing up and people being like, who are you? What's your role? What are you doing? We're expected and we're well liked within the county. So MSU-1 and MSU-2 both have a lot of different toys on them. We have most of the capabilities of an ambulance minus transport, plus extras. We do carry like a video glide scope. The glide scope is what we carry for intubation in addition to direct laryngoscopy. We also carry an ultrasound, which is not carried by anybody else in the county. We're also integrated enough that we are part of the planning for all of the events. We staff a lot of the events. We staff concerts. We staff football games. If the president comes to town, we're part of the medical planning for what do you do if something happens, and we're integrated into that process. And that I think is a pretty invaluable part of the education here, because very rarely do you have a program where you're doing the field responses and you're so ingrained into the EMS culture that you have that ability to do as part of your day-to-day work. As part of the residency, we do have the opportunity to be involved in the medical control for Yellowstone National Park EMS system. So we are the online medical control for Yellowstone National Park. If the medics in Yellowstone have a question, if they have a need and they have cell reception, they are able to call us and we are performing the medical control for them. Great opportunity is also doing a rotation in Yellowstone. So I spent a month in Yellowstone as a early third year resident in August. It's a rural EMS rotation. And it's actually the rotation that really made me decide I wanted to do an EMS fellowship. But you get to see the whole park. You get to integrate into the park EMS system. You work on projects. You try to improve the system. You try to figure out what are the problems. And we now have an opportunity to go to the Smoky Mountains. So we are picking up medical control for the Smoky Mountain National Park. It will be another wilderness rotation with, again, entirely different problems, entirely different needs than either Kalamazoo County or Yellowstone National Park. And so I'm really excited for the residents here to be a part of that as well.
So when you come to WMed, you get the full breadth of emergency medicine from pediatrics to geriatrics. And so you get to see that wide volume of pathology that you need for a full education.